Welcome to Thoracic Bandage application presented by ShakyPaws. Alright, the next bandage we're going to show you in the bandage series is going to be a thoracic or chest wrap. Multiple reasons for the chest wrap. Usually it's either wounds or a suction tubing in the chest or a drainage. So we got a little example here for you. So some of the materials you're going to need is your elasticon, your cast padding, your stretch gauze or Kling, non-porous tape, and a little Telfa pad like we did with the neck wrap. And of course your trusty bandage scissors. Now with this bandage, just like the neck wrap with the triple lumen or central lines, you're going to put a little bit of triple antibiotic ointment on there, and you're going to go around the port of the drain or chest tube just to keep that nice and clean and sterile for us. And then you're going to go ahead and take your Kling and start wrapping it around the port. So you can go in front of the port and behind the port, just kind of like a crisscross type pattern. But for our greyhounds, it doesn't really show it for this guy, but for the greyhounds with a deep chest, those bandages shift all the time. So you end up making a little t-shirt for these guys and going around the front limbs like so to make a little t-shirt for our friends. It just helps keep the bandage in place, making sure not to add any tension. This is a protective bandage, not a tension bandage. It's not a pressure bandage. Please do not add any tension doing that. And then you're going to go ahead and take a little bit of your Kling and follow the same path, going around the chest, making sure you're not causing any wrinkles. Even though it's not a pressure bandage, adding wrinkles still potentially can cause issues for you. So just crisscrossing, making like a figure 8 pattern, going around the port itself and the front 2 limbs, like so. Last, our tertiary layer is going to be our VetWrap friends. You need to be very careful about this layer. Remember, with VetWrap, it does have elastic in it. So my recommendation is always to unroll and then lay. Unroll and then lay. Can be a little bit challenging when you're going around limbs, keeping the VetWrap flat. Like so. Again, making sure it's not too tight, or just gently placing it on there for protection. Now we do have the non-porous tape. You can use this or you don't have to. For this particular chest tube, it's kind of sticking up away from the patient. This doesn't really bother me. But say if it was longer and it was kind of flopping around like so, I don't necessarily like that. I need that to stay clean. So I'm going to kind of make like a little butterfly type friend and direct that to a place that's going to be a little bit cleaner and a little bit more stable. And there is our chest wrap. Thanks for watching this video, and for further information about ShakyPaws, check out the links below.